We consume a lot of meat. Such kind of food would also deteriorate our condition of the liver.
Most common cause of this fatty liver or liver disease is changing habits of food. We very rarely eat homemade food. Yes, definitely. If you see, red meat are actually cause of many disease. Liver cancer, definitely, because it's rich in actually fat, so it can affect your liver also. Once they'll have complications of this disease, like bloody vomiting, water in the tummy, there is infection in the water which is already in the tummy. They'll have some effects on the kidney, forgetfulness, or they can become unconscious. So these are the complications which indicates that this person now need liver transplant.
Hub Nepal, स्वास्थ्य पहुँच समयमा सबैमा।
नया सा नया जीवन।
नमस्ते र स्वागत छ सबैलाई। आज हामीसँग हुनुहुन्छ भारतका प्रख्यात लिभर ट्रान्सप्लान्ट सर्जन डाक्टर शैलेन्द्र लालवानी। 20 वर्षभन्दा बढी अनुभव र 1000 भन्दा धेरै सफल लिभर ट्रान्सप्लान्टको सफलता हासिल गर्नुभएका डाक्टर लालवानी आफ्नो संस्थाको लिभर ट्रान्सप्लान्टेसन र हेपाटोप्यान्क्रियाटिक बाइलेरी सर्जरी विभागको प्रमुख हुनुहुन्छ। उहाँले आधुनिक प्रविधिहरूको प्रयोग गर्दै जटिल र सर्जरीहरूमा आफ्नो अद्वितीय योगदान पुर्याउनु भएको छ। आउनुहोस् डाक्टर लालवानीको यात्रा र लिभर ट्रान्सप्लान्टको रोचक संसारको बारेमा जानकारी हासिल गरौँ। यो विशेष कार्यक्रम हामीले अंग्रेजी भाषामा राखेका छौँ, हाम्रो डाक्टरलाई पनि सबै कुरा विस्तृतमा राम्ररी तपाईलाई बुझाउनको लागि।
Hub Nepal, स्वास्थ्य पहुँच समयमा सबैमा।
So, Dr. Sahab, for us, for a lot of general Nepali people, we consume a lot of meat. We are like meat eaters.
Yeah.
We love meat. Especially red meat is also served in our country, especially with buffalo. Such kind of food would also deteriorate our condition of the liver.
Yes, definitely. If you see, red meat are actually cause of many disease. If you can see, colon cancer, stomach cancer, liver cancer, definitely.
Mm-hmm.
So if you eat more red meat, it can cause a lot of cancers and definitely a lot of diseases also, like heart problems also, because it's rich in actually fat.
Okay.
So it can affect your liver also and kidneys also.
So technically, if you could possibly tell us, what would be the level where we say that if we surpass this level, now it's a fatty liver, and if we surpass this particular level, now this person actually needs an attention of a liver transplantation.
So see, fatty liver is different and chronic liver disease which needs liver transplant is totally two separate disease.
Okay.
Fatty liver is when you take excess amount of fat deposited in the liver.
Mm-hmm.
So that is the, I'll say, first stage of chronic liver disease.
Okay.
If you treat it on time, it will recover.
Okay.
So for diagnosis of fatty liver, we generally do blood test and ultrasound.
Okay.
If blood tests are deranged, we tell them to do the ultrasound. Ultrasound can show you that it's the grading of fatty liver, like 1, 2, 3. So if it is still in fatty stage, you can treat it on time. Try to tell them that they should eat this healthy food, reduce some weight by exercise and jogging, and that fatty liver we can treat. If they'll reduce weight, take healthy diet, that liver can become normal. But if we will not treat it for many years, like 10 years plus, it will go into a fibrosis stage.
Okay,
and then gradually it can be cirrhosis of liver, like chronic liver disease.
Any kind of a food or well, obviously unhealthy foods are out of the question, but any specific kind of foods that they are not allowed to intake after a liver?
No, we normally tell them to take clean and cooked food.
Okay.
Raw food we don't allow them initially. Just important thing is that they have to take clean and cooked food. That is most important. Yes, we tried to tell them that they should not take this I'll say fatty food, more fatty food. Initially we try to avoid non-veg because they can catch infections. But if it is well cooked meat also, they can take.
Times are changing so fast. A lot of technological revolution coming across in every sector. I'm sure you are experiencing it at yours too. with AI coming in and possibly robotic surgery coming in. Having all these there, and at the same time you giving in your best to take care of your patients, you're also traveling abroad to Sudan and other countries and offering them free service and doing the transplantations. In this entire lifestyle that you have, how do you keep yourself updated with all the advancement that's been happening?
So I think the upgradation is definitely important, because for that you need actually, I'll say you have to counsel yourself that yes, you need upgradations. For that, it's the most important thing is that you have to attend the conferences, which is happening time to time. At least twice in a year, you should go to a national kind of conference and you should attend what other people are doing, what is new in the like in your field. So I think that is the most important thing. And yes, you have to upgrade yourself. As you said that robotic surgery is new, but it was, if you see 5 years back, it was new. But now everyone is doing robotic surgery in India. So that is the most, in AI definitely, but the most important thing in future, what I see is stem cell therapy. That is going to come in a big way, maybe after 10 years, but yes, that is the next thing.
You just explored with us that you are also been using robotic surgery.
Yes.
How much has it been helping you? As in, like, you have a big team that works along with you, and then now there's a new team member, which is a robot. So how are you?
So see, people have the general misconception that robotic surgery is done by robot.
Okay.
So, but it is done by surgeon only. But he is sitting somewhere, and they are putting some ports, 4 or 5 ports in your body, and he is sitting and doing it. So it's robotic system, but surgeon is doing it. So I'll say the advantage is for both surgeon as well as for patient. For surgeon, advantage is he can sit there and he can do the surgery comfortably. If he is tired in between, he can take 5-10 minutes break also. While doing surgery on table, it's very difficult to take break, and you are standing for maybe 10 hours, 12 hours. So that is the advantage for surgeons. For patient, so like keyhole surgery, 4 small holes in the body and the surgery is done. So recovery is fast, pain is less. So that is the advantage for the patient also.
So I'm asking very openly, please, if you would want to or not want to answer this question, you can please keep it to yourself. Let us know accordingly. AI coming in and robotic surgery advancing. Do you think a day is going to come where robots will be the only one making the surgery perform?
I don't think so.
Never, sir?
Open surgery is not going to vanish.
Never?
That will be the most common surgery even if you go to 10-20 years from today. So every surgeon has to learn this open surgery for sure, because everything cannot be done by robotic surgery. So there are actually some selection criteria for robotic surgery. I don't know in what will happen in from 10 years down the lane, but still, if you see nowadays, I'll give you an example of simple cholecystectomy, gallbladder surgery. Okay, when we were being trained, it used to be open. Okay, but nowadays maximum new surgeons will learn laparoscopic cholecystectomy or robotic cholecystectomy. But I'll say 4-5 cases out of 100 you have to open. There is no other alternative. If you continue with laparoscopy or robotic, you are going to damage you are going to create the complication then. So in that case, you ultimately have to open. So you have to learn open technique for sure. There is no doubt about that. So it's not going to replace it, yes, but 90%, I'll say 80%, 70% surgeries will be done by robot. But for 20-30%, you will need that training of open surgery also.
Thank you for keeping this as a mark, doctor. 20-30% only by doctors, and then 70% can be from the robots. Wow.
Yes, I think, see, the advantage with robot is you can reach up to that area which is not possible even by open surgery sometime. So that is the advantage, definitely.
I'm sure. Thank you so much for being this open and letting me know on this topic, because I know, you're an expert on that, and a lot of people at different industries and segments, everybody is scared that AI and robots are going to be coming up. And thank you so much for letting us know this so openly.
कलेजो मानव शरीरको सबैभन्दा ठूलो आन्तरिक अङ्ग हो। रोचक कुरा के हो भने कलेजो एक मात्र यस्तो अङ्ग हो जसले आफूलाई पुनर्जनन गर्न सक्छ र केही महिनाभित्रै पूर्ण आकारमा बढ्न सक्छ।
Shedding a little light onto the chronic liver disease, Doctor. Like when do we know that a person would actually require a liver transplantation surgery that could change their lives?
So basically, there are few symptoms. If any person, like suddenly they'll not come to know that they are suffering from chronic liver disease. So initially they'll start having some like symptoms. They'll have jaundice, they'll have anorexia, they can have vomiting, they can have weight loss, they can have some fluid swelling in the legs, they can have some water in the tummy. So tummy will started bloating up. So these are the symptoms when they go to doctors. So then doctor will evaluate, they'll see the blood test, they'll do the ultrasound, and if ultrasound is showing that he is suffering from chronic liver disease, then definitely endoscopy, fibroscan and CT scan, these are the three important things which they'll require. And the problem, the thing is that these symptoms or these investigation will not indicate us about transplant. Once they'll have complications of this disease, like bloody vomiting, water in the tummy, there is infection in the water which is already in the tummy, they'll have some effects on the kidney, they'll have some effects on the lung also, they'll have some hepatic encephalopathy like forgetfulness, or they can become unconscious. So these are the complications which indicates that this person now need liver transplant. So along with symptom, complications, and after seeing blood test, fibroscan, endoscopy, then we decide that this person will need liver transplant. But if you see in one line, if you want to ask me in one line that what are the indications for liver transplant, that is chronic liver disease with complications.
All right. You just indicated me about the donor, and I'm pretty much enthusiastic to learn this more, because any liver transplant patient would require a donor.
Yes.
As per the guidelines that I believe, it has to be a sibling or someone from the family itself.
Yes.
This is the norm. So how do we exactly determine, Doctor, that this particular person would be suitable for being the donor?
So first, there are some requirements for liver donation. One, it has to be, as you said, it has to be from either family, or there has to be some relationship between the donor and patient that they have to prove on papers.
Okay.
If the donor is available in the family, then there are few criteria. Again, donor should be between 18 to 55 years of age, same or matching blood group. Nowadays we do ABO incompatible also, so blood group doesn't matter even nowadays.
Okay.
If it is even different blood group, we can do ABO incompatible liver transplant in these patients. The other things are that he or she should not be that fatty, because the liver will be fatty. Other things are, again, as I said, that in even patient, they should not have any cardiac or pulmonary problem, lungs problem. So these are the normally selection criteria for donor. So once we find that this is the suitable donor on basis of these things, then donor has to undergo some test like blood test, CT scan, cardiopulmonary checkup and everything.
Okay.
And if that is okay, then only we can take him as a donor.
So this person who comes in being a donor, so once one person donates his or her own liver, wouldn't that be a complication for their own body?
So see, that's what I am telling you, that once donor will come to us, we will do a lot of tests.
Okay.
Initially we will do some blood test, blood group, blood test. Then if that is okay, then we go into a second stage where we do CT scan.
Okay.
If on CT scan anatomy is okay, like, and volumes, like whatever we are going to remove from him and whatever we are going to leave in him, if that is enough for donor as well as patient, then we select him as a donor only. If there is any problem in this, we normally refuse them. We cannot take them as a donor.
Okay, sir.
So once they meet the criteria only, then only. Even after CT scan, we do a lot of cardiopulmonary checkup like heart checkup, lung checkup. If they are fit only, then we can take him or her as a donor. Otherwise, we normally reject them and we tell the family that you have to bring the other donor.
So, Doctor, my understanding, I believe a lot of people have this question in their mind, that there is one liver in the entire body, right? So, if a donor donates the liver, is it the wholesome liver that they donate, or is it
No.
part that they donate?
It's part of, actually liver is having right and left part.
Okay.
And even when the recipient is small, like we do in small children's liver transplant, so we take left lateral lobe, the most smallest part of the liver.
Okay.
I'll say, so it's for adult we normally take right lobe or left lobe depending on the size or volume of the liver as well as anatomy. So normally we take, if you see in an adult patient, we take 60%, 65% of liver from the donor.
Okay.
If you will leave even 30% liver in the donor, that will be good enough for him to live normal life.
So it regenerates is what?
Yes. It regenerates whatever we'll remove from the donor and whatever we'll put in the recipient, patient. The liver will grow in patient also and in donor also.
Both ends.
Yeah.
So you would actually leave us only 30% of the...
That is the minimum which we can leave.
And the 70% grows on its own.
Yes.
What will be the duration, doctor? For how long?
It's more like anatomical growth than not functional growth than anatomical growth. So functional growth is more important. So liver function will become normal before the discharge of the donor. Like within 7 days, the liver function will become normal. But if you want to ask me about the size of the liver, that will take 6 weeks to 6 months.
6 weeks to 6 months.
Yeah.
And that person becomes...
But that starts from the day one only.
Okay.
But if you want to ask me that when it will become normal size, it will take 6 weeks to 6 months.
So for a donor, it wouldn't be much of a problem if they are healthy.
Oh, if they are healthy, if they are fit on, still there is a small risk, I'll say 0.5%, which is always there when you travel, when you cross the road, when you are sitting even, earthquake can come.
Right.
So that small risk you always take in your life. So that is the small risk which is involved in the donor hepatectomy if donor is fit on evaluation.
Okay. And what are the kind of risks that the patient has to go through?
See, patient will have a risk of around 5 to 7%, I'll say. Okay. Because in recipient, if you do 100 transplant, 5 or 7 will not survive, but 93-94% is a good success rate. Because of different problems can happen in recipient. The most common problem is rejection. Body can reject the liver because it's from another person. So that is the most common cause of, I'll say, unsuccessful liver transplant. But it happens in 2-3% cases only. The other complications can be vascular complication like hepatic artery thrombosis, portal vein thrombosis, bleeding, bile leak. These are the infection they can catch. So these are the problems can happen immediately after transplant. But once they are discharged from the hospital, there is very I'll say less chance that they'll have some problems in the future. If they'll take medications on time, definitely they'll take care of infections and they'll take care of their diet also.
I'm sure with the doctors like you in their hands, they will walk out very safe, is what I really believe.
We try our best actually from our side, yes.
So Doctor, once they walk out, when they are discharged, how long would the liver transplant patient take time to recover to the full health state?
See, they are usually got discharged within 2 to 3 weeks from the hospital. But initial, I'll say 3 months are actually important because if you see initially 1 month, we do a lot of tests to see about the recovery of the liver and if there is any rejection, if there is any complication. So initially we do liver function test, ultrasound if required, a lot of other blood tests. So that is very frequent initially, like twice a week. But after 1 month, we do it once in a month. Then after 6 months, if you see, we do once in 3 months. And after 1 year, we do once in 6 months only.
Okay.
So initial 3 months are very important, as I said. You have to take care of your medicine. You have to take care of your diet, exercise, physiotherapy. Everything is important initially. So if first 3 months he is okay, then there is a very high chance that he will live long life.
अन्य अङ्गहरू जस्तै कलेजो पनि एक जीवित व्यक्तिले दान गर्न सक्छ। जीवित दाता कलेजो प्रत्यारोपणमा दाताबाट कलेजोको एक भाग हटाएर प्राप्तकर्तामा प्रत्यारोपण गरिन्छ। नेपालमा पहिलो सफल जीवित दाता कलेजो प्रत्यारोपण सन् 2009 मा गरिएको थियो।
In this particular donation of a liver, what would be the difference between a living donor and a deceased donor?
See, in living donor, one of the family member or relative has to donate part of their liver. This is called as living donor liver transplant. We take, as I said, that 60-65%, maximum 70 we take, and we put it in the recipient. And that will need donor surgery as well as recipient surgery. So this is called as living donor liver transplant, where a live person is giving a part of their liver. In deceased donor, if some person is in the hospital who had accident or any, like I'll say, bleeding in the brain, and because of that his brain is not working. His heart is pumping, but brain is not working. And the possibility of like recovery of that person is 0.
Okay.
Then we ask the family that if they want, they can donate. We explain them that it's very unlikely that he'll survive, and if you want, you can donate the organs. So if family agrees, then we take all the organs from that donor, I'll say, and this is called as deceased donor liver transplant, where we put the complete liver from that person and we put it into the recipient or patient.
So here, any family member association is not required?
No. If any donor is, any means like brain dead person is in any hospital, they can donate to anyone. Like it's in India, if you come, it will be according to this sickness of the person and the listing.
Okay.
The earlier you will register, you will have more chance of getting that organ.
All right.
And if you are too sick, then definitely the chances will be more. So it's according, you don't need any relation in that.
What kind of donors are coming in? What is the percentage between these two? How many are living donors and how many are deceased donors?
See, it depends. Like if you go to Western countries, maximum transplants are deceased donor liver transplant. I'll say 90% of transplant they do is deceased donor liver.
That's huge, 90%.
Yeah, but if you come to India, again, I'll say if you go to South India, the ratio is 50-50. And if you come to North India, it's, I'll say, only 3 to 4%. I'll say not even 3 to 4%, 1 to 2% are actually deceased donor liver transplant. 97-98% are actually living donor liver transplant.
Doctor, possibly getting you back to what our patient would want to ask. If any person gets diagnosed with a chronic liver disease or even with a liver disease, they start getting panicky about things. They're like, oh, my time is now gonna end soon, and there's a lot of anxiety. What would be the kind of advices that you would want to give to people who have been diagnosed with chronic ailments?
So see, there are, again, I'll say there's nothing like that you should panic. First thing, you have to, if you are diagnosed, you have to go to a good hepatologist. Evaluate yourself thoroughly, like full in like say a lot of checkup has to be done. Then only we can decide that what treatment they need. So there are different stages in liver disease also, chronic liver disease also, like A, B, C. We use normally child criteria. If it is A or B, you can get yourself treated by medicine only. As I said, for liver transplant, there are some criteria. So even if patient is in child's A or child's B, most of these patients can be treated by medicines only. So they should not panic. And I'll say a lot of patients in this stage can be treated by medicines only, and they can reverse the fibrosis also.
Okay.
But if they are in child C stage, they are more likely to likely candidate for liver transplants in the future. But still, if they are in child C, they don't have any complication, we can delay the transplants with medicines.
All right.
But once they meet the criteria, my suggestion will be that as soon as possible they should undergo liver transplant, because success rate, if you come with less complication or less sicker stage, the success rate of liver transplant will be better definitely than once they come with the complications, lot of complications, and in a stage where even with transplant they will not have good survival.
And this whole scene, Dr. Sahib, I just want to curiously ask you again, is people who come in with a liver disease who require transplantation but are not able to get a suitable donor because maybe there aren't anybody in their family member who would be willing to do it, or maybe less in numbers itself, that we can't find the best donor from that. How do you address this problem?
So we normally register them for deceased donor liver transplant.
Okay.
So once the organ is available, but as I said, the chances are very less. And because in North India, as I said, only 1 or 2% transplants are deceased donor liver transplant. So then most of these patients will die on the waiting list for the waiting for the organ to come.
Okay.
So I think for that, actually, if you ask me personally, I would like to promote the deceased donor liver transplant for these type of patients. Even for any patient, as a surgeon, if you ask me, if I have option of doing deceased donor liver transplant and living donor liver transplant, I'll go ahead with deceased donor liver transplant. Because in living donor, you have to take risk in the donor also. Although minimum 0.5%, but there's definitely risk is there.
True.
So as a surgeon, if you ask me, I would love to do deceased donor liver transplant.
Also, thank you so much for answering these questions. I'm going to be taking you towards our first round. That is rapid fire questions.
Okay.
A few questions just to possibly learn a little more about you on a personal level.
Sure.
Please don't be diplomatic and let me know the answers the way that they are. Doctor, what's that one thing you've always wanted to learn but never had the time?
I'll say inguinal hernia surgery, laparoscopic inguinal hernia surgery. Not time, but whenever I try to learn it, because if you learn it once, if you will not do it for 3 months, you will again forget.
Okay.
So this was the surgery still I miss actually, but I'm not interested in that now because I'm a liver transplant surgeon. I focused myself on liver transplant. But yes, I tried it for 3-4 times, but then never did it. So that is the thing.
Life is long, sir. You're like right there, young.
Yeah, but I don't want to do it now.
Okay.
Because there are a lot of young surgeons, or I'll say general surgeons. They do it better definitely than me. So they can do it.
All right, sir. If you could make one improvement to the healthcare system as a whole in India, what would that be, Doctor?
I'll say I'll improve public healthcare there.
Okay.
Because private sector is already developed and time to time they do the upgradation also. But in government setup, we need a lot of improvements.
What's the weirdest food combo that you secretly love? Some food.
I'm not that foodie actually. I'm more towards healthy food like fruits and salads. So I don't miss anything actually in food.
Huh? Not specific food that you say, I love this, but...
No.
If you had a superpower for one day, what would it be? What kind of a superpower would you require and how would you use it?
So, with one superpower you cannot do anything. But what my wish is, everyone should be healthy and happy.
Okay. So you would be the one who would bless everybody.
Yes.
Wow. Are you a tea or a coffee person?
I'm a tea person.
Tea. Sure. What's the most random thing on your bucket list that no one knows about also? That you would possibly share with me here?
Travel.
Any
to hilly areas or I'll say mountains and hill stations.
Wow.
I love hills and rivers.
We would love to invite you again and again to our country in Nepal because we are rich in this.
Yes.
And you are going to enjoy our country to the best.
फ्याटी लिभर रोगका 2 मुख्य प्रकार छन्। नन एल्कोहलिक फ्याटी लिभर डिजिज यो अत्यधिक मदिरा सेवन नगरी उत्पन्न हुन्छ र अर्को एल्कोहलिक फ्याटी लिभर डिजिज यो अत्यधिक मदिरा सेवनका कारण उत्पन्न हुन्छ।
These patients are people who are actually either suffering or actually not even suffering. A lot of general people have a few myths in their mind. I'm going to be placing a few one-liner myths.
Sure.
Just let us know if these myths actually do exist or they're false. What's up? Myth. Liver disease is always caused by alcohol consumption.
No. It's a myth. It's not true. Because the most common cause, again, as I said, it's NASH-related chronic liver disease, which is because of fatty liver and because of diabetes. These patients will have liver disease. Nowadays, this is the most common cause. And I'll say, yes, alcohol is one of the most common cause, but the other causes are hepatitis B and C. So liver is not the only cause.
Okay. Alcohol. So not only.
Alcohol is not the only. Yes. Alcohol is not. Yes.
And what if someone is actually an alcohol, he consumes a lot of alcohol, but actually does not get any liver disease at all? Isn't that surprising?
So it depends actually, because it depends on your lifestyle and genetics definitely. So there are a lot of things which is undiscovered till now. This is the thing in that. Like a lot of people will take alcohol regularly and they'll never develop liver disease. And a few patients will take alcohol for 1 year, 2 years, and they'll have liver disease. So it's a complicated matter, still unsorted, I'll say. Or means it depends on the genes as well as their lifestyle.
All right. Liver damage is irreversible.
So I'll say partially true, because if they are in a stage where it's not possible to revert it, then definitely. So it depends on the stage where we are diagnosing these patients. If it is in child's A, it is reversible. It's like it's fatty liver, it's reversible. It's early fibrosis, it's reversible. But if it is in cirrhosis stage, it's very unlikely to reverse it. But yes, you can delay the complications, but you cannot reverse it.
All right. Liver transplants are only for adults?
No, we do a lot of transplants for pediatric patients also. We do 4, 5 months, 6 months old pediatric patients also.
Such little babies also, they're
Yes.
4, 5 months and they actually require a liver transplant.
Yes, because of some genetic disease, and the most common cause is like biliary atresia, where from birth they don't have biliary channels. So they'll have jaundice from the birth. So this is the most common source. Small children, because of genetic disease and biliary atresia, they need liver transplant also.
A liver transplant is a guaranteed cure.
Not guaranteed, but yes, success rate is good, I'll say. 95% success rate is, anyway, it's better than 0%. Because, see, you have to see that if you will not do liver transplant, they are not going to survive. So, on one side, it's 0%, on the other side, it's 95%. It's a very good survival, and after liver transplant, I can say people live long life nowadays. Maybe 20, 30, 40 years also. So I think it's a good procedure.
It's a blessing also.
Yes.
And 95% is a very
Yes.
very, very strong. You can drink alcohol after a liver transplant.
No. This is wrong. You cannot take alcohol. As I said, you have to live healthy lifestyle, like in your eating also, and they should not even take a single drop of alcohol.
Not at all. So if someone undergoes a liver transplant surgery,
They cannot. Because see, if they'll start drinking again, after 1 year, maybe 1.5 years, they'll need liver transplant again.
Oh, yeah. That would be like changing clothes.
So,
Liver transplants are only for the wealthy people.
no, I think it's if you see 10-15 years back, the cost of liver transplant was very high. Nowadays, actually, the cost is reduced drastically. So, I'll say maximum population can afford it now.
With your permission, Dr. Sir, if you could let us know in INR itself, what would be the estimated cost?
See, it depends on the center to center, but if you see in Indian rupees, it's at different center between 18 to 20 lakh rupees now.
18 to 20 lakhs INR.
Yeah.
Indian rupees.
Yes.
All right. Or the last myth that I have in my hand, I saw right now. Anti-rejection medications are too dangerous to take.
No. See, if you are going through liver transplant, you have to take lifelong medications. But as I said, we tell them to do frequent tests initially. That is just to prevent rejection also, and to prevent the complication of this immunosuppression also.
Okay.
So once this, we decide it in 1.5 or 2 months, the dose. So once dose is decided, you have to continue it for whole life, maybe 1 or 2 medications. So it's not dangerous because we don't give it in excess. We give it in a very controlled way, and where we monitor the drug levels also, and then we change it accordingly. So it's not dangerous. Nowadays it's safe.
Right. Also, I have this another myth which is possibly ringing in my head. Liver problems or such chronic liver diseases are very much associated to genetics. Like if someone in the family tree has a liver problem, someone again in the family tree would have the possibility of having it more. Is this true?
No, I don't think so. Because yes, few patients comes with the this genetic disease, but then they come in a very early stage, like early stage of life, like within 10 years, I'll say. So there is definitely there are definitely liver problems which is because of genetic problems. But most of the disease are actually acquired. I'll say fatty liver, which is acquired. If you take excess fatty food, then you will have fatty liver. Alcohol, this is acquired. This is not genetic. Hepatitis B and C, this is infection which is transmitted. This is not genetic. So again, I'll say 95% of 95 or 97% patients are actually having some acquired disease as compared to genetic disease.
So genes have less role.
Yes, less role. Yes.
It's completely lifestyle.
Yes.
It's one's person. It's actually in everybody's hand.
Yes.
Do I want this ailment or not?
Yes.
I'm a little curious about the donor's life too. Once they've donated, as you rightly said, in about 6 weeks to 6 months, they're going to fully recover. But at any point in time, will they also they might go through a chronic liver disease?
And see, if they are living a healthy lifestyle, then they will not have. Yes, if in future they are getting some like hepatitis B or hepatitis C infection, so then they can, yes, if they start alcohol, then they can suffer from chronic liver disease, yes. But if they try to live healthy lifestyle, they don't get any infection, it's very unlikely for them to have chronic liver disease.
Sir, you've given this Vigyan a lot of gyan on liver transplantation today. I'm so happy for that, and I'm gracefully thankful for this particular session that I had with you. Well, this might not be the last question that I'll be putting across to you, but if you could let us know, Dr. in the short future, in the next 5 years, what are the kind of revolutions or kind of advancements that you are looking real rapid that's going to be coming in for liver transplantation?
So I'm hopeful that not 5 years, but I'm hopeful that stem cell therapy will come maybe in next 10 years. And as you said, the robotic is definitely still developing, yes, but in 5 years it will take over most of the open surgeries. But yes, as again I said, open will be still I'll say the most common surgeries being performed worldwide. So I think these are the two things, stem cell therapy and robotic, we are thinking about.
All right, Dr. As we end this particular show for today, any message that you have for our Nepali brothers and sisters, anything that you would want to tell them?
I think stay healthy and stay happy.
Like
eat healthy food and live a healthy lifestyle.
Anything that they should think about when it's about liver?
I think avoid alcohol.
Thank you for this last note, Doctor.
Thank you.
And
so
I really
much.
wish that people do follow it. Thank you so much for coming in.
Thank you so much.
Graciously and being a part of this. Thank you so much, Doctor.
Thank you.
Namaskar.
डाक्टर शैलेन्द्र लालवानीलाई आज हाम्रो विशेष कार्यक्रममा आफ्नो बहुमूल्य ज्ञान र अनुभव बाँड्नु भएकोमा धेरै धेरै धन्यवाद। जटिल लिभर रोगका बिरामीहरूका लागि नयाँ जीवन दिने र लिभर ट्रान्सप्लान्टको क्षेत्रमा महत्त्वपूर्ण भूमिका खेल्नु भएको तपाईको योगदान वास्तवमै प्रेरणादायी छ डाक्टर शैलेन्द्र। यस्तै ज्ञानवर्धक चर्चा गर्नका लागि अर्को एपिसोडमा पक्कै नै भेट्ने छौं। धन्यवाद। सुरक्षित रहनुहोस् र सकारात्मकता फैलाइरहनुहोस्। जय नेपाल।
नया सा नया जीवन।
डॉक्टर्स हब नेपाल, स्वास्थ्य पहुँच समयमा सबैमा।